Hello and welcome back to another Aurum Meridian podcast. I'm your host, Robert Hawkins, and today we are bridging the gap between medical and dental. My guest today, he joins me from the other side of the pond, maybe the other side of the fence, but we're going to tear down that fence, the other side of the bridge. We're going to tear down the other side of the bridge as well to Dr. Hugh Coyne. Dr. Coyne, welcome.
Oh, thanks so much for having me on. It's a real pleasure to be joining you on the podcast, Robert.
Excellent. Dr. Coyne, you're a medical doctor practicing in London. Tell me, how did you get involved in this whole movement of medical dental integration?
Yeah, that's a really good question. So we have a really keen interest in our practice on early prevention or early detection rather and prevention of disease. And we really see that oral health and dental health as being a really unaddressed factor in the both the early detection and the prevention of disease. And we think it is incredible opportunity for both dentists and doctors to understand how oral health has such a massive impact on so many systemic diseases.
That's incredible. And you touch on a really good point. Dentistry, generally speaking, on average, sees patients more regularly than the medical side of things. Are there early disease signals or what are some of the ones that, you've identified that dentistry can address?
Well, that's a great question because here in the UK, as you pointed out, most patients see their dentist more regularly than they see their doctor, which means that the person with the most consistent view of their health is often not a physician, it is their dentist. And of course, ironically, that is often the person that people claim that they are incredibly afraid of. And so we have a quite unusual situation that dentists are seeing patients who feel completely well. They are not necessarily presenting with any symptoms. They are not actively seeking medical care. And that is a fantastic window of early detection of disease and where early detection of disease is incredibly valuable. And I always go on about this, but this idea is not new. As far back as 1891, Willoughby Miller described the mouth as being the source of as being a source of systemic disease. He understood that what happened in the oral cavity doesn't stay there. And I think that, somewhat absurdly, for over a century, dentistry and medicine have somehow drifted apart, despite often doing training together for the first few years. And essentially, we are treating the different areas of the body with different records. There's very little communication between each tribe, if you like. And despite this, we're dealing with the same patient, and neither medically or biologically does that make any sense. I I think that dentists are fantastic at picking up medical issues already. So things like the recurrent ulceration of Crohn's disease, the discoid lesions of sarcoids, the gingival hypertrophy that people get with leukemia, or plaques of lichen planus, or the dry mouth in Sjogren's. But the mouth is a window, an interface, if you like, to the rest of the body. And I think that both dentists and medical doctors need to be more mindful of the link between more routine dental disease and systemic conditions. So, as an example, periodontal disease is not just a local disease of the mouth, it's linked to cardiovascular disease, it's linked to type 2 diabetes, to kidney disease. And oral pathogens can enter the bloodstream. Inflammation in the mouth can contribute to systemic inflammation. So, when a dentist is seeing someone who perhaps has advanced periodontitis, or and that patient may consider themselves well, they are looking at a patient who has significantly elevated risk of having strokes or heart attacks or diabetes that hasn't been identified by their doctor. And really importantly, I think patients are very open to this. They are very willing to undergo screening in dental settings and to be told that actually, you know what, this is a risk factor for you having a heart attack or a stroke, and perhaps get this checked with your doctor, or get your blood pressure checked with your doctor, or get your HbA1c checked with your doctor. So dentists are seeing patients at a really opportune moment, in a really opportune setting to detect disease early.
That's incredible. So tell me what, as you go through and you're like, I agree, patients going to see their dentists more, they're so much more informed now, especially we've got this beautiful,
Mm.
crazy, overwhelming thing called AI. There was a statistic that I think that would said that in 1 month alone, and it was in the United States, there were over 250,000 entries into Chat GPT, people putting the most personal health data into this big open model, which anyone can really draw from. It's crazy, but it's also powerful. So how are you seeing patients come into your practice? And then how do you view that changing with dentists interacting with these more informed patients and then also getting health screenings as well too, or asking for health screenings? How do you see that? How is that changing, and where do you see that going in the future?
Yeah, absolutely. That is the AI is a huge factor, and certainly, for years now, we would see people coming in with things that they had researched on Google, and now the extent of that is much greater, and the detail is often much greater with patients coming in with um, quite hefty reports for us to imbibe quite quickly in a matter of seconds. And it's a good job that in both in medicine and dentistry, you get used to to reading at great speed these reports, and a lot of them can offer a tremendous value. I think with patient use of AI, so in the studies so far, that when patients are using AI for medical or healthcare information, that sometimes can be led down the wrong path. And it's slightly different when the healthcare professional, be it the doctor or the medical doctor or the dentist, is using AI as an adjunct, because AI, as we all know, can hallucinate. It can make quite elementary mistakes, and sometimes can lead people down the wrong path. And and that's why I've no problem. In fact, I think it's great that people are so interested and engaged and want to do a bit of additional research and come in, and we can have a great chat. And we're fortunate here to be able to have the time to spend with patients, that we can have those lovely chats with people and go through things, and sometimes laugh at what the AI has suggested, and sometimes say, do you know what? That is that is spot on. And sometimes, I will be, making a joke of it and say, yeah, yeah, do you know, I'm glad ChatGPT agrees with me, or Claude agrees with me.
Hmm.
And
Yeah.
and I think so. And in terms of the kind of second part of what you were saying there, and how people are coming in for health screens, one of the things that we are being much more proactive about now in our health screenings is when we're giving the questionnaire to people before they come in and they fill out their online questionnaire, we are asking them about their dental health. We're asking about them about how often they brush, how often they floss, have they seen their dentist, have they seen their hygienist, what their dental health is like, do they have any issues? And then we have a really thorough look, a really thorough examination inside their oral cavity. And I think that is incredibly important, because I think we need to be doing better as a medical profession in signposting people to dental surgeons. And the reason for that is that it is so important in the control of their systemic diseases. So things like blood pressure, things like diabetes, things like Alzheimer's risk of certain cancers. And and I think there is an incredible opportunity for more cross collaboration between dentistry and medicine. And I think that's where this is so exciting, because there is so much to be gained from both professions collaborating more. And and I think that's a really exciting opportunity. I think that the difficulty potentially is just that both professions are kind of time pressed, and everyone was, do I have the time to do this? Um, but it's so important that we do, because potentially we can make huge savings in healthcare from dentists identifying medical conditions early and doctors identifying dental conditions and sending people to their dentist. So that is one of the most frequent outcomes I have from a health screening is, do you know what, you should go and see your dentist or go and see your, I cannot, but like here be probably be less the case in Canada, less the case in the US, but here, yeah, people have not frequently seen their hygienist. So I am often sending people to their hygienist. It's like, please go and see your hygienist, go and see your dentist, have a checkup, and please floss.
Well, I'm not going to make a joke about the stereotype about British teeth and teeth in the UK. I'm not going to do that. I was looking on your website. All of your
Well done.
team have beautiful teeth, so you are really truly living that. They understand the importance of oral healthcare. But what I really loved about what you just said is it's really a two-way street. You're saying go see your hygienist or your dentist, and then on the other side, you're saying let's collaborate more with them. So have the dentist and the
Mm,
hygienist say, hey, there's some biomarkers here. There's some issues that could be bigger in your whole body. You need to go see your medical doctor, your family physician, whatever it may be. And I
mm,
love also that you've tied it into efficiency in the health in the whole overall healthcare system, right? So it's preventative, it's more effective, it's less taxing on the system as well too. And really from a
mm.
patient perspective, I love seeing that. I love that you've adopted the AI as well too. And it's so important and it's so relevant and current as well too. So I really like that approach. So dentistry truly is now shifting towards a preventative whole body approach. So what would you say? How can we be ready from your perspective? What practices can we be incorporating in dental offices, in hygiene clinics, in surgery, in dental labs, if you've got to take?
Yeah, so I think there are loads. That is a great question. So there are lots of things that are already happening in dental clinics, for example, that can easily be or can be incredibly useful for the patient's medical doctor. So, patients will frequently have their blood pressure checked in a dental office, and particularly if it's before a significant procedure. And that is an incredible opportunity because we know that blood pressure is such an enormous problem and so much of it goes unidentified. So one of the things I think is a sad indictment of the medical profession, but it's a great stat. So over half of adults have high blood pressure, but only half of them know about it, and only half of those are treated, and only half of those who are treated properly. So there is an incredible opportunity for identification of this incredibly important risk factor that massively increases the risk of stroke and heart attack. So that's the first thing. One thing that I would love to see um, uh, practitioners in the dental surgery be more interested in is checking people's blood biomarkers, or having a more awareness of their blood biomarkers, because I think it impacts potentially both what happens in the dental chair and what happens to their systemic health. And certainly, we know people are much more enthusiastic, just like they're much more enthusiastic about using AI, about ordering a home blood test kit or going to a lab and having their blood test done. And so very often patients will have this information, but won't have had the direction of exactly what to do with it. And I think, again,
Mhm.
that's another huge opportunity.
So taking responsibility into their own hands is so critical, especially in Canada as well too, with the public healthcare system. Um, we're sort of trained to think that that's the standard, right? The public healthcare is the standard, but really it's designed for acute care. So if you need more than that, you've got to take it into your own hands. You've got to go seek out all the information you need. So I really like that. getting the test done, looking at the blood biomarkers in a dental clinic is fantastic. How would they go about learning or learning what they don't know and then also interpreting those results as well too? How do you envision that? Do you envision the dental industry taking on all of that, or at least what is that interaction and that patient consultation look like? Are they ordering it and then the results and then they integrate with you and then you have a conversation? How does that look like for you?
Yeah, that's a great question. So I think there's lots of ways to do it potentially. So sometimes it may be that the dentist just takes an interest in whether the patient has had these blood tests done either recently with their doctor or through their public healthcare system, or whether they've proactively gone and had some blood tests done. It is very often the case. And there have also been plenty of initiatives where the idea of the blood test being done in the dental clinic setting, typically using finger prick blood testing and a capillary tube, and then having an analyzer in the dental clinic, and that can be giving incredible information. And we know that from several studies that have several pilot studies that have been done, that this is incredibly useful in case finding, particularly, and where the most evidence is particularly for HbA1c. So that is a marker that is used to diagnose diabetes and pre-diabetes, and that has shown really great success at picking up people who have pre-diabetes. And other pilot studies have shown that when looking for cardiovascular risk markers, that the majority of patients, when checked in the dental clinic, had at least one cardiovascular risk marker outside of the normal range, which is phenomenal. Like that is, and it's a phenomenal opportunity to do something about their health. Obviously, the doing a blood test or interpreting blood tests, it has to be within the regulatory scope of practice in that jurisdiction.
Hmm.
Um, but I certainly think that there are certain biomarkers where it's actually very important for the dentist to know about, because it impacts it impacts how they treat patients in their own dental chair.
Absolutely. Would love for you at some point to share with us the links to those studies because that's incredible, and
Yeah,
so
absolutely.
powerful as well too. Yeah. Um, We talked a little bit, when we were planning this conversation about everyone's the other favorite acronym that seems to be everywhere now, and that's a GLP-1. And so, can you tell us a little bit about your findings of how GLP-1s are impacting oral health?
Yeah, absolutely. So GLP-1s now is certainly here, but I I think throughout North America as well, I think are having an enormous impact on the overall health of the population. I think when they are used for the appropriate patients, they are an absolutely incredible medication. They have a really interesting history, which I find fascinating, that there's sort of years of iterative science and innovation that allowed the development of these medications, and the accidental the sort of almost accidental recognition of these substances called incretins when insulin was trying to be purified, and then much later, the isolation of this substance GLP-1, and then the cruel irony that um, when it's released from the stomach, it then lasts only seconds. And then the finding that with the saliva of the Gila monster lizard, which is a lizard in the southern states of the US, that they were able to synthesize a GLP-1 that lasted much longer, and that was the first iteration of these medications. And like many of the best medications, its current use as a weight loss medication was actually a side effect of its initial intended use. So it was initially intended to be a weight loss medication, and it is sorry, initially intended to be a diabetes medication and is now a
Mhm.
weight loss medication. But its effects go beyond weight loss. We know that because of its effect on visceral fat, that it has an impact on overall systemic inflammation in the body. So it reduces things like IL-6, TNF alpha, highly sensitive CRP, all these inflammatory proteins. And that has a really important impact on people's overall health. In terms of your great question, how does it specifically impact dental health? Well, there are both good and bad things. So the good things are related to this effect of it being able to reduce inflammation. So it, for example, uh, um, in it reducing the inflammation in the body, that we know that, for example, that is has potential impact on periodontal disease. We know that it has osteogenic effects, and surprisingly, actually, these agents actually that they reduce alveolar bone resorption, and they enhance implant osseointegration. So people were very worried about its impact on bone mineralization, but it actually has shown almost the opposite effect. They reduce oxidative stress. Um, people who have type 2 diabetes and were treated with one of these medications had significantly less peri-implant marginal bone loss. So the effects can be very beneficial. It can have a wonderful effect on sleep apnea, for example, and is now
Mhm.
licensed for that use in the US, because obviously because people lose weight, and that is one of the most important things, one of the most important implicating factors in obstructive sleep apnea. And um, there's a huge overlap, a huge coexistence between obstructive sleep apnea and type 2 diabetes. So in people with type 2 diabetes, the rates of sleep apnea are about 80%. So again, that's really important for oral health, but it does have some potential side effects. So obviously, one of the issues with GLP-1s is that it can increase the risk of acid reflux, and so this can potentially cause erosion of teeth. And obviously that is far from ideal. The flip side though is that it will improve diabetes control. It will improve, so people's HbA1c will go down. They People often eat less sugar. People feel compelled to eat more healthy food. But they can become a little bit dehydrated, so they can get things like issues like xerostomia in the mouth, so they can get quite dry mouth. And then also, because of this issue of it relaxing the lower esophageal sphincter in the stomach and allowing more that it slows the gastric emptying from the stomach, there is an increased risk of aspiration of gastric contents when people are undergoing particularly surgical procedures. So it's very important that dentists are cognizant of that doing surgical procedures, particularly when sedation is required, because there's that higher risk of aspiration. And so it's important um, for dental practitioners to be inquisitive about whether patients are on it. And not everyone is very forthcoming about that, sometimes
Mhm.
by accident, sometimes accidentally, because they don't quite consider it as being a normal medication, or it hasn't been prescribed by their usual doctor. Sometimes here it's been prescribed online. And then sometimes people are getting it because they're getting it from illegitimate sources as well. And then, of
Mhm.
course, that it can cause can potentially increase the risk of halitosis, which of course would be a really common presentation to dentists, and that again is related to the slowing of the gastric emptying, and and the xerostomia, the dry mouth, and so there's a sort of multitude of implications dental wise, and I think it's for that reason it's a particularly fascinating medicine and one that I think every dentist should be particularly aware of.
I think of you just unpacked so many things. I got a few follow-up questions for you, so
Yeah,
I'll let you catch your breath. One of the, we could probably do an entire session just on GLP-1s and the effect because it's so popular for
yeah,
so many reasons, right? And
yeah.
I did a session not too long ago with Dr. Manassi, and she's like, we're not in vogue. Like it doesn't stop here. Like it's all connected, right? So, one of the things you mentioned there, which is really so popular here in North America, and I'm sure in on your side as well too, is sleep. So airway, sleep apnea, and bridging that gap about truly trying to find the right solution to treat the apnea. So not just putting a band-aid, whether it's a CPAP machine, a mandibular advancement device. There's pharma coming out that's addressing it as well too. There's even some that are being looked at. Tell me a little bit about your perspective on how you're treating and identifying sleep apnea as it relates to all of those different options.
Yeah, that's a great question. So the first thing to say about sleep apnea is that it is, although it's in vogue, it's incredibly underdiagnosed in medicine, and it's one of the things again that we proactively screen for in in our health screening consultations because it's so incredibly important. It's implicated as that in diabetes, in higher risk of high blood pressure, in risk of heart disease, in risk of stroke, increased risk of dementia. There's so many things, and not only that, it's it's the impact and quality of life.
Hmm.
People's their work lives are
Yeah.
massively impacted. Their focus and attention and cognition are all hugely affected. And then on top of that, there is the increased risk of accidents. So there is from recollection, a 40% increased risk of having a road traffic accident for someone who has untreated sleep apnea. So it's incredibly important that it's recognized, and dentists are at the front line of that with recognizing the some of the key features of that, whether it's the high arch palate or the enlarged tongue or the signs of bruxism. And there are, of course, plenty of validated questionnaires and anthropomorphic assessments that can be done that can further enhance the early detection. And um, the as I said, the impact with diabetes is incredibly important, and we know that in people who have overweight or obesity, those fat deposits in the upper airway tract narrow the airway, and the muscle activity in the area is reduced, and this leads to these hypoxic and apneic episodes. We know that these then worsen systemic inflammation, it worsens sugar control, and then that increases the risk of periodontitis, of course. So it's very important, and that, of course, can impact dental management, healing. So it's so important thinking about these synergistic relationships of OSA, diabetes, obesity, oral health. They're important for all of us clinicians in medicine and in dentistry to recognize. And in terms of the treatments for you know, obviously, as you said, there's the mandibular advancement devices, the CPAP, which I find is very variably tolerated with
Mhm.
people. For some people, it can be absolutely wonderful, and some people hate it and liken it to being having their head stuck out the side of a high-speed train. So, like they're in the TGV in France or something. Um, and yeah, and this is where medications like tirzepatide, the GLP-1s, can act to help people lose weight, lose those fatty deposits that are around the airways, and reduce the number of apneas, um, and that is fantastic potential opportunity.
I want to meet the person that said, you know what? I'm going to test some lizard spit to see if it's going to work in the GLP-1. I want to know, how did you come up with that? How did you
Yeah,
think to go and stick your little thing inside a little lizard and test the spit? How, like, I would never think that. So that, to me, that's just hilarious. But what an incredible impact it's having on the world.
yeah.
That's such a great answer. Sleep is so important. And we're both parents to younger kids, so we're living that one for sure. Uh, have you read the book Breathe by James Nestor?
Yes, yes, yeah.
What did you think? I got to get your take on that because I've heard really mixed reviews on it.
So it's it's funny because it partly inspired a talk that I gave to colleagues at it's a um, medical wellness retreat, if you like. It's for doctors it's called Well Medics, so it's to sort of enhance their resilience and their own well-being and get doctors to look after themselves. And I think
Mhm.
one of the observations I would make about it is that a lot of these self-help books follow a very similar pattern in that they have a hero's journey story architecture where the writer is presented as the guru. Um, and in this case, the author James Nestor is going to visit lots of different gurus and taking their advice and passing it on to the reader. And I think there is there's some credence to what is said. I think, for example, that I'm very interested in sports medicine and performance, and I think so I would be reading a lot on some of those breathwork practices, for example, like and in particularly in relation to whether there is a usefulness in those CO2 tolerability um, breath work practices. I think there is a lot of benefit for certain breath work practices in reducing the parasympathetic nervous system. I think it's one of those, breath work for relaxation or indeed for ramping up the nervous system can be incredibly effective. And it's something that I find easier to get behind, say, than doing perhaps something like mindfulness meditation, because I know that that kind of breathwork practice has a physiological effect. I know from medical physiology that it does work. So I think certain of the practices are really useful. I think a lot of them perhaps a lot of the practices mentioned perhaps have less evidence. So, for example, that the CO2 training combined with zone two, for example, the idea of which is you do nasal breathing while you're doing low intensity exercise. And there actually isn't that much good evidence to show that um, that's of benefit for most people. I think it can be useful for for self testing, but I suspect the biggest benefit isn't actually in increasing VO2 max. It's more in improving breathing efficiency, diaphragmatic control, and remaining as relaxed as possible as the ventilation rises. So I think it's one where that perhaps the benefits are slightly overblown.
Yeah, one of the sarcastic criticisms. I hosted an airway study club for dentists here in Calgary, and one of the guys, we were talking about it offline, and he said, "Yeah, just breathe through your nose, and all your problems will be solved. You'll be gone, no problem." And I
Yeah,
kind of
yeah.
chuckled at that
I
because
mean, yeah,
that isn't not the takeaway, but I think overall, I mean, I would say the biggest benefit from that book was that it got people talking about it more. It got people talking
yeah,
about breath work, about airway, about sleep, and it probably shown a spotlight on some of the myths out there, and it
yeah. I
sort
think
of. Yeah, go ahead. Yeah.
Yeah, I think it's really interesting. It's a sort of double-edged sword, isn't it?
Hmm.
Because I think it's really important to highlight some of these issues. And absolutely, some patients I will see, do breathe dysfunctionally or do have issue breathing through their nose because they have lots of nasal congestion, or um, they do have a, an issue that would be solved by seeing a good orthodontist, and that their breathing would be much improved by that. But I think some of the yeah, and but I think on the flip side, it's also there is a sort of slight oddity of that. Okay, now need to be told how to breathe. It's and I think
Yeah.
one of the problems in the kind of longevity sphere, or I think also just in the healthcare spheres, is making things much more complicated than they need to be. And you know the you know and as an example, from that book of the trying to breathe through your nose while exercising. So, really, there isn't really any evidence that that improves VO2 max or endurance performance. It improves people's breath hold time, so they can hold their breath for longer. There's there's not that many practical relevance to that other than trying to beat one of your kids and doing a length down the pool,
Yeah.
Uh,
Yeah.
but yeah, so I think sometimes it's a little bit overcomplicating what is actually quite simple.
Yeah. Well said. I agree. Um, I've got a quick fire segment. Shall we get into it? I mean,
Go ahead. Yeah.
we've covered so much ground. We're gonna have to do another one of these. So let's jump right into what I call, still a working title at this point. It's called Wisdom Bites. Okay. I'm gonna throw
Okay.
a few questions at you. Whatever comes off the top of your head, it can be controversial, doesn't matter. And so let's just get right into it. Okay. And they're not controversial questions unless you answer them
Okay.
controversially.
I
So
can
go
I
for
can
it.
make them controversial. Yeah. For
Please do.
clickbait.
Give
Yeah.
me one controversial take. Yeah, for the
Yeah.
clickbait, everything. Yeah. So first one, what is the most important biomarker dentists should track first?
Okay, so I think that is HbA1c because th this is not very controversial. It already has guideline level endorsement for use in the dental setting, and it has the strongest evidence base for clinical impact by a mile. So HbA1c.
Okay, perfect. And recommended methodology for identifying it?
So in the dental practice, the studies have been with finger prick and a device in the practice. These are validated devices that work really well, but it can be a venous blood draw, whether that's in the dental practice or it's referred to an outside laboratory, and it's incredibly valuable, as I said, and just to explain what HbA1c is, because I probably should explain, because I'm saying HbA1c rather glibly. So HbA1c is sugar attached to hemoglobin, and it attaches to hemoglobin is essentially is a chemical reaction that occurs over time. It is similar to the Maillard reaction. So when you're grilling a steak on the barbecue, or roasting a piece of beef, and you want to sear it on the outside, that's the Maillard reaction happening, and it's exactly the same thing that is happening in the body. It's sugar attaching to protein by a chemical reaction. It's just happening much more slowly and at a lower temperature. And so in the bloodstream, glucose attaches to hemoglobin, and the hemoglobin, because as we say, glycated, and we're measuring the amount of hemoglobin that has been glycated. And the hemoglobin in the body lasts about 120 days. So it gives me an idea of what the blood sugar has been like over the past 120 days. And typically, people would have around, normal patients, they would have around about 5% of their hemoglobin would be glycated. But in poorly controlled diabetes, it can reach 10% or higher. And it is, so the study was called Find Risk. This was point of care HbA1c, and they found 30 to 40% of patients that they tested had diabetes or pre-diabetes. So
Well,
phenomenal.
and early prevention and diagnosis is so key in treating all
Yeah.
of that and getting patients back on track. Tell me, next one, what is the biggest missed opportunity in dental practices today?
Okay, so this one I think probably is a little bit controversial. It is knowing your patient's blood work. So your patient might have diabetes, which can impact on what you do in the dental chair, or they might have low platelets causing excessive bleeding, or they might have low hemoglobin, which will affect their tolerance for treatment or tissue repair, or they might have low vitamin D that through no fault of the implantologist causes implant failure, or they might have
Mm.
highly sensitive CRP due to an underlying systemic inflammation that worsens their periodontal disease, or because they have an underlying infection that's going to affect your treatment. But if you're a dentist, you do not know any of those things unless you check their blood work. So I think that is really important. And that's the biggest missed opportunity.
Beautiful, beautiful. So on the patient side of things, next question would be, what is one thing every patient should know about inflammation?
Oh, what a great question. Okay, so people think about inflammation as just something that happens in their joints, their knees or their elbow or their shoulder. It is something that happens in the lining of their arteries and it accelerates atherosclerosis, leading to strokes and heart attacks. So it's really important that people are aware of that.
I love that succinct answer. And when your dentist asks you about your health history, that's a great reason why you should answer because there's oral markers. Okay,
Yeah.
here's the controversial one. And don't be shy on this one, okay? Most overhyped versus most underhyped health trend.
Okay. So ordinary movement, just everyday movement like walking, is vastly underestimated. We have somehow turned movement into something that requires special clothes, a subscription, a wearable, a studio, a playlist, an electrolyte drink, and then a protein shake. But for most of our history, for most of human history, movement was the normal human condition rather than a health intervention. So movement, walking in particular, that, lifting weights and flossing, they're the most underrated. The most overhyped, I was going to talk about peptides, but I've just been going on about how great one peptide was. So I can't, I can't then say the rest are all rubbish. I think probably the most overhyped is probably NAD plus supplements because they are um, arguably the longevity intervention where the that they have leapt forward of the evidence base. So there was a large review of 33 human trials, and it found that these supplements they do safely raise NAD plus levels, and but their effects on functional metabolic vascular health, none of the outcomes that matters were meaningful. So
Hmm.
despite this, NAD plus boosters are the most marketed, commercially anti-aging supplements, and the consumer market has vastly outpaced the science on those ones. So I don't think they're harmful. They do raise NAD plus. I'm not sure that they do an awful lot extra of benefit.
Well, your most underhyped one hits home with me. I'm 42 and I'm already feeling stiff in the mornings and I have to get up and move. And yeah, you're absolutely right. You don't need sweat wicking material clothes and the best playlist on Spotify. Just get up and move.
Yeah,
Get off your backside, away from the computer, put your screen down and just go move. Chase your kids around. That's how I get most of my
yeah,
exercise these days.
yeah,
So
yeah.
yeah.
And chasing your kids around is now, what's called high intensity interval training. Yeah, so
So you mean I don't have to go to F45 anymore? I can
that,
just
that's
chase
it.
my kids around.
That
Okay.
they also double as a kettlebell.
Okay. Oh yeah, good one. Yeah, just don't drop them. Yeah. Okay, last one. And this is a tough one, so I'll give you a minute to think about it. And that's what is one piece of advice you want people to walk away with today? Whether it's and let's cater it towards towards the dental side. Um, what is one piece of advice you want dentists to walk away from our conversation today?
So the biggest thing that I would say for dentists to walk away with is that they are already having a huge impact on people's systemic health, on their overall health. And I didn't think I'd be saying this, but I don't think dentists are great at advertising this because, you know, we were, you mentioned Amanda C, those, amazing at producing these beautiful smiles. But the it is not just about the beautiful smile. And that is wonderful and incredible and has such an impact for people. But also that beautiful smile is contributing to that patient's overall health. And that is so important. And I think not enough is made of that. And I think that that's where dentists need to be thinking and recognizing the important role that they play because the oral cavity is such an important intersection of medicine and and dentistry. It is a critical indicator of people's overall health. And the pathology in the mouth has a massive impact on the rest of the body. And it's not recognized enough by any of the healthcare professionals, medical doctors or dentists. And we know that when people ignore their oral health, not only will it worsen local issues in the mouth, but it will have significant repercussions in chronic diseases. So dentists need to think of themselves as being at the vanguard, at the forefront of systemic health and longevity.
I love that so much. You mentioned marketing off the bat, and they don't market themselves as being a part of the overall patient healthcare. As a marketing guy, I'm thinking, okay, you've got to, you've got a picture, a post on online or whatever, a billboard, but it's the dentist, it's the medical doctor, and it's the patient all in one saying, we're both here to serve the patient. It's not my care doesn't stop at the chin or whatever, right?
Mm.
So
Yeah.
I really like that take. And let's just throw it out there into the world right now and just say, hey, let's start working more closely together, really for the benefit of the patient. Let's do joint messaging. Let's do co-marketing to say, here's how we are working together, and let's create that norm. So when the patient walks in and the dentist asks them about their blood history or other kind of medical history, they don't go, "What?" Or when they walk in to see you and you ask them about their dental history, they go, "Why are you asking me about my teeth?" Right? So let's break down that barrier. Let's build that bridge now, and then create those. Let's create those bridges together and that integration.
100%. Yeah.
Dr. Coyne, this has been so informative. I know there's going to be a ton of questions. So please, if you've got any questions, post them up on the YouTube channel, on our YouTube channel. You can find Dr. Coyne. He is on socials. He's at Coyne_medical. So if you're listening, if you're driving, hopefully you're not underslept. So it's COYNE_medical online on the socials, and then coinmedical.com on his website. Thank you so much for your time. I really appreciate it. So we're gonna have to do another one. And before we
Yeah,
actually
I'd love
sign
that.
off, I
Yeah.
forgot one thing. You've got a colleague. We're gonna do another one as well too. Um, but a lot of the things that you just talked about in identifying these, you've got something coming out, and give me a sneak peek as much as you can. You've got some courses coming out which the dental industry can join their medical peers as well to learn about all of these and how they can incorporate in practice. Give me that information, and then we'll throw it in the link as well too in the description.
Yeah, fantastic. Thanks so much. Yeah, so we're really excited to be part of the Dental Education Studios Wellness Dentistry course alongside the amazing Katie Toe. Both Lucy and I, so Lucy's my wife, but also the co-founder, Co-Medical. She is yeah, definitely far better doctor than I am, but both of us are going to be speaking at that. We're incredibly excited to be involved in that. And then later in the year, we'll be releasing a series of courses of lectures that are all about the oral systemic interaction and going into that in huge detail.
That's fantastic. Katie's wonderful. She's also a guest on our show.
Oh
And
yeah,
so,
yeah,
yeah,
amazing.
and I've met her a few times as well too. Her, Dr. Amanda C, the whole group just really leading the way in terms of wellness dentistry. So if they want to go and see these courses through Dental Education Studios, where's the best place to go?
Yeah, so I would just either onto the Dental Education Studios socials online or direct to their website, and there's a link to the course right there. And yeah, I think it's really exciting. There's a great lineup and of incredible speakers who are immensely talented, and a lot of people who are a great inspiration to me and who I look up to a great deal. And yeah, so I think it's going to be a fantastic event.
Amazing. They'll be on the Aurum Group website as well too. Those events, I can guarantee you that because this education, these courses, you, your wife, so important to this movement and to everything that we're doing as an organization as well too. We've got some great guests coming up on the podcast as well too. We've got Dr. Brandon Pryor, Dr. Travis Campbell. You know those two guys quite well. Any
Yeah,
any juicy, funny stories that we can grill them about when they're
well,
on?
look, I know that Brandon has been he's swanning around Europe for the past few weeks, and Euro maxing as the phrase goes. So he looks like he's been having a great time. So yeah, hopefully he remembers. You know, he's remembered some dentistry by the time he gets back. But yeah, he's yeah, he's a great guy, and yeah, glad that he's had a break because I know he works very hard.
Excellent. Well, Dr. Coyne, once again, thank you so much for your time. I really appreciate it in the sweltering UK heat there. And I will just say for everyone listening at home, I hope you found this conversation useful. I hope it was worth your time, and I hope you found some guidance from the Aurum Meridian. That's it for us today. Thank you so much, and
Thanks,
we'll see you next
thanks,
time.
Robert.
Thank
Thank
you.
you.